Here is your stem.
Okay, ma'am.
Okay, so if you've read and understood, considering it critical care scenario, please tell me how would you manage this patient now?
Considering the scenario, I will manage the patient according to the ABC protocol.
Okay.
I go rapidly check the air of the patient. If patient is able to talk, air is intact. Then I check the breathing. I will check the respiratory rate, rhythm, um, chest wall movement, raised JVP, oxygen saturation. I percuss the chest to exclude the hyperresonance or dull, and I will auscultate to see the breath sound.
All
For
right.
the man, okay.
What is your provisional and differential diagnosis for this scenario? What has happened to the patient?
Okay, my first professional diagnosis is the tension pneumothorax. My differential is the uh, hemothorax or cardiac tamponade.
Okay, so for that purpose, all the management you've told me until now, what is your next step? What
Yes, I manage the patient.
you've told me.
Yes, my diagnosis is pneumothorax, so I give the oxygen of the patient, and I'll insert the needle in the second intercostal space in mid clavicular line. Then I'll do the X-ray,
Okay,
and then
right.
I'll go.
Yes. Please tell me what are the different types of pneumothorax? What exactly happens in pneumothorax?
Okay, ma'am. There is different types of pneumothorax, like the open or closed, primary, secondary, simple, or tension pneumothorax. In pneumothorax, air lies outside the lungs within the pleural space.
Okay,
And
so
in case
you
of
have
tension,
done X-ray. This is the X-ray just pose of your patient, this same patient, maybe, right?
yes,
So
yes,
how
ma'am.
would you read it? Can you help me and read this for me, please?
Okay, ma'am. This is the X-ray chest showing the trachea shift to the right, hypertransfusion to the right lungs field, and I cannot see the costophrenic angle properly and diaphragm. And there is also the maybe stomach in the chest wall.
Yes. And so if you have to read the X-ray, I would appreciate if you can read it according to A, B,
ABC.
C, D, and
Yes.
E, right?
Yes, ma'am. Yes.
So, right. So according to that, you did not tell me which, if you could see any date, what type is it? Is
Yes,
it of
it's
a
not the
male, female?
tension. Oh,
Yes.
sorry.
Yes.
Tension pneumothorax.
So it's showing tension pneumothorax,
Yes,
right?
ma'am.
So how should the patient be managed now? If it is tension pneumothorax,
At first, I'll needle thoracostomy in second intercostal space, followed by tube thoracostomy in the safety triangle.
okay. So basically, how would you differentiate tension pneumothorax from simple pneumothorax?
In simple pneumothorax, air within the pleural space, and the patient will not be the hemodynamic unstable. In case of the tension pneumothorax, there is the one-way valve, air leak from the lungs or the chest wall and escape and accumulate within the thoracic cavity, push the trachea and the mediastinum to the opposite side, flattening the diaphragm. There will be the respiratory compromised dyspnea, hypotension, tachypnea, tachycardia,
Okay,
raised JBP.
right. According to the NICE guidelines, what is the technique by which you should insert central venous line?
Yes, ma'am. I will insert the central line. under ultrasonogram guidance, and after insertion, I'll do the X-ray to see the position of the line.
Okay,
The
but
tip of the
according
line.
to the NICE guidelines, there are certain prerequisites that patient should be in which position.
Yes, ma'am. It's the
So you
Tendelbar
have to tell me
position, head.
everything. Yes.
Yes, Tendelbar position, head down and leg up, and follow the Seldanger techniques.
Yes.
And
And
in
location.
the location is, yes, ma'am, it's the lateral to the carotid pulsation between the two head of the sternocleidomastoid above the clavicle, and the coronal plane for 30-degree angle towards the ipsilateral nipple.
So what is the surface marking of internal jugular vein?
Yes, it's from the ear level to the medial end of the sternum.
Medial end of the clavicle.
Sorry, clavicle.
Okay, right. After you've inserted the central line, what is the procedure for, what is the procedure for removing the central line?
Yes, ma'am. I will remove the central line, head down, and compression to avoid the air embolism.
Air embolism, right. Okay, please tell me, right, there are different sites at which central venous line can be inserted. Can you
Yes,
name
ma'am.
few?
Yes, ma'am. Internal jugular vein, subclavian vein, femoral vein,
Okay, good.
peripherally inserted
Why femoral
central.
vein is not an ideal site for central venous line? It's emergency site, but not an ideal site. Why?
Sorry, ma'am.
Okay, you can come back to this later. All right, if you have to tell me, right, if you leave the central venous line inside for a prolonged period of time, it leads to causation of infection. Which
Yes,
ones,
ma'am.
what is the most common organism that can be
Yes,
found?
Staphylococcus epidermidis.
Okay, how would you treat then that infection?
Yes, I give the flucloxacillin of the patient and remove the catheter, dressing, and antibiotic according to the local
Trust guidelines.
trust guidelines.
All right, please tell me what are the complications? Okay, one complication you've already assessed, pneumothorax. What are the other complications that can occur
Yes,
because
ma'am.
of insertion of central venous line?
Yes, there may be the infection, thrombosis, air embolism, arrhythmia. There will be the perforation of the right atrium. There will be the cardiac tamponade. Puncture the carotid artery. There will be the hemorrhage, hemothorax, pseudoaneurysm. If
Okay,
I perform the left side, there will be the injury to the thoracic tract and chylothorax.
all right. In which situations central venous line is indicated? One, you could see the patient
Yes,
needed dialysis. What other reasons could there
yes,
be?
ma'am. Yes, ma'am. For monitoring the fluid, fluid balance and the resuscitation, total parenteral nutrition, certain drugs and fluids that contains the high potassium level. When peripheral venous access is failed, hemodialysis already mentioned, and the transvenous cardiac spacing.
Okay, good. Right. If a patient post-operatively you've inserted the needle and you've taken care of patient's pneumothorax, how would you assess patient's breathing post pneumothorax?
Yes,
What would you
ma'am.
consider?
Yes, I'll check the respiratory rate, rhythm, chest wall movement, as well as I see the chest X-ray and ABG.
Yes, and the use of respiratory muscles,
Yes,
pattern,
yes,
inspection of the skin color, nail beds,
yes,
percussion,
nail bed, ma'am.
auscultation, everything. Okay,
Yes, ma'am.
good. Thank you. There was another thing I had to clear yours.
Ma'am, why not the femoral vein?
That's a source of infection, most common.
Thank you.
Okay, in this one, yes, you told me this. There was another question I had to tell you. I had to tell you the answer.